Hey you guys, welcome back to my channel. I am trying to be quiet right now because JJ and Collins are both sleeping. So today, well, happy Valentine's Day. It is Friday. I don't usually like to film the same day that I post, but it is really crazy with two kids. I feel like I say that all the time, but it is, it's hard to get stuff done. So I still wanted to get my video up for today and fill you guys in on Collins' 2-week checkup because she had that this past Tuesday, and also my epidural injury. So let's just dive right in. Collins, on day 13 of her life, so that was Monday, the day before a 2-week checkup, her umbilical cord fell out, so the little stump that was still in there fell out, so we could officially give her a bath. We didn't give her first bath until, I want to say I did it on Wednesday, and I did a little bath with JJ and Collins together. It was so cute. I'll put a picture in right here so you guys can see it. So I took her in for her 2-week checkup, and we are seeing the same pediatrician that we take JJ to, Dr. Tran in San Ramon, and he is phenomenal. If you do have Kaiser and you're looking for a pediatrician, Dr. Tran is so great. I'm sorry, I need to clear my throat. So we went in for her checkup, and she ended up being 9 pounds and ½ an ounce. So at birth, I need to get water, oh my goodness. Okay, sorry. At birth, Collins weighed 8 pounds 4 ounces, and then when we took her to her 2-day postpartum appointment, the lactation appointment that I went to, when she was 2 days old, she weighed 7 pounds 15 ounces. And again, I said in a previous video, it's normal for them to lose weight because usually the mom's milk hasn't come in and they're just drinking the colostrum. So that's all she was having. I was formula feeding as well, but I wasn't giving her, I guess, enough, because even the lactation person said that, the lactation consultant said that I could give her way more than I was. So anyways, she is gaining weight like a champ, and she is actually, she drinks about 4 ounces every 2 hours, 2 to 3 hours. But because of her weight gain and she's doing so well, the doctor said that we do not need to wake her up at all during the day or at night. He said just let her sleep, let her get her rest, and when she wakes up and she wants to eat, feed her. So that's what we're doing, which has been so nice. And since he said that, and we're not waking her up, because I had an alarm on my phone going off every 2 hours to feed her at night because I was just so concerned about getting her food. And since he said that, I think it was Tuesday or Wednesday night, she slept for 4 hours straight. So from midnight till 4 a.m. And I was like, okay, I know 4 hours seems like nothing, but it was amazing because she had been waking up every hour and a half, 2 hours. So, but I'm not gonna say that we're in the clear and everything's golden, because then last night, well, she slept for a 3-hour stretch, but then she woke up and she ate, and she does this sometimes. She'll eat, and then I think she's awake because of gas bubbles. I think because she seems fussy, you know, and she doesn't want to eat anything else, but she's just kind of cranky and whining, and so I think it's that. But then also sometimes she just finishes feeding and then she just stares at me like this, wide-eyed. I'm like, go to sleep. What are you doing? And she just wants to sit there and stare at me. And then if I put her down in her bed, she doesn't want to go to bed. Then she'll start fussing. She just wants to be held and look at me. Oh, she's waking up right now. I'm gonna make her a bottle really quick. Here she is. Look at her cute little Valentine's Day outfit. Oh, sorry. Let me see you. Are you still tired? Say hi, everyone. She's like, leave me alone, feed me. Okay, let me get you wrapped up in your little blankie, okay? You're so cute. So she's eating great. Sleep is hit or miss still. Also, as far as sleeping, I think this witching hour is real with her. I don't remember it with JJ, but around 9 p.m., it's like she wakes up, she's not tired, we'll feed her, and then she eats, and then she's just up and so fussy. It's nothing will make her stop crying. This started happening probably 3 nights ago, and it's happened every night. And it takes me a couple hours to finally get her down and asleep. So I've tried walking around with her, I've tried rocking her, I've tried, now I hear JJ. JJ just woke up from his nap. Oh, eye goop, so, or eye boogers, whatever you want to call it. Newborns have that. It looks, I remember with JJ, I was concerned he had some sort of eye infection or pink eye or something like that, because there was always stuff coming out of his eyes throughout the day. I felt like he always constantly had eye boogers that I was wiping away, and it's common, it's normal for newborns because it's their tear ducts developing. So I brought it up to her doctor on Tuesday, and he said, yes, you're right, that's what it is. And I said, okay, that's what I remember you telling me with JJ. So if your kid has that, if your baby has that, don't worry, it's normal. Also, her little baby vagina is swollen, and it's gone down quite a bit, but she was born and it was so swollen down there. It looked like testicles. It looked like she had just a little ball sack down there, basically, because her little baby lips are so swollen. And that is completely normal. So that has to do with the mom's hormones, and I believe he said leaving their body, leaving the baby's body. So also the mom's hormones leaving the baby's body. There's 2 other things he told me about. One, if she has discharge, which she has white discharge that's been built up inside of her lips down there, and you're supposed to leave it, you're not supposed to wipe it away, which is so hard to clean her when she poops, because the poops are all liquidy and gross, and so then it goes up and gets stuck in there, and you do have to wipe it out so it's not in there. But you're not supposed to wipe the white stuff away. It goes away on its own, apparently. But also, if you have a little girl and she bleeds down there a little bit from her vagina, or if she has leaky boobs, almost like she's lactating, both of those things apparently are normal, and they're the mom's hormones leaving the baby's body. So I didn't know that. My doctor told me that, and thank goodness he did, because if her vagina started bleeding or her boobs started leaking, I would freak out, not knowing what it was. Now, if they did that, I would probably still call the doctor just to double check. But yeah, he said that that would be completely normal if that did happen with her. It did not, but if it did, or if you do have a girl, don't freak out right away. But other than that, she's smiling, she smiles in her sleep. She'll smile when she's awake too. She does look at us, she stares at us, but then she also kind of stares at us and looks off to the left. And I know that they can't fully, their vision is going to be developing over the next few months. So I don't know exactly what she's seeing, but she's trying, and she knows we're here. I think that's it as far as updates for her. She's just adorable. We're so in love with her. Well, I want to move on to my epidural injury. And I didn't know that's what it was right away. I have had lower back pain ever since I was in the recovery side of the hospital after I had her. And I just thought it was from laying in that hospital bed for a while. I think I mentioned it in another video. And then as time has gone on, it's been over 2 weeks now, I just felt it's gotten progressively worse. And I thought, okay, there's like a disc issue back there, or something moved when I gave birth and I need to be readjusted because it just hurts so bad. It hurts to walk. It hurts to go up and down the stairs. It hurts to just put weight on my left leg. So if I'm trying to put pants on and I put all my weight on my left leg, it just wants to buckle and give out because that's how bad it hurts. Putting socks on or shoes on. I mean, I have to sit down to do all of that. I can't chase JJ around because it hurts to run, and all he wants to do is run for me when I'm trying to change his diaper or get him dressed or get his shoes on, or when we're outside or I'm trying to get him in the car. It's just, and I can't do it. So finally I called a chiropractor. I went and saw a chiropractor, which I'm not big on, but I thought I needed to be adjusted. So I went on Wednesday and he adjusted me and we started talking. Well, first we were talking about when this started happening, and he said, well, this could be an epidural injury. And I was like, well, that would make perfect sense, because when I had my epidural, only my left leg went numb and I could feel everything else. I could feel my right leg was kind of tingly. I could feel every contraction in my stomach and in my back. So I'm like, well, that completely makes sense because it was my left leg that was affected. So he was kind of just poking and prodding at my back, and I don't know if he was trying to do acupressure, but he wasn't really pushing that hard. It was just like a light. So I don't know. He did that for a little bit and then was like, okay, well, you need to come back and see me 2 times a week for the next 6 weeks. I'm like, okay, no problem. I'll give you a call and book my next appointment once I figure out my schedule with my husband. And no, like I left there in just as much pain as I came in with. So no, I'm not going to go back. And then I was just so discouraged, and my mom was like, you just need to call Kaiser. They need to take care of this. So I called Kaiser. I had to talk to an advice nurse on the phone. She set me up with a phone appointment with a doctor for later that day. So this was Wednesday afternoon. A doctor was going to call me around 5 o'clock. And because my doctor wasn't available. So I talked to a doctor on the phone. I tell her what's going on. She said, okay, go into the lab. It's open till 6. So go into the lab tonight. You need to do a urine test, a blood test, and an x-ray. Because we want to make sure that the urine and blood tests were to make sure that there wasn't an infection. I didn't have an infection, a urine infection, or maybe something else going on in there from the epidural, because that stuff can happen too, and it's really serious. So I went in and did all of that, and then had an appointment for 9 a.m. the next morning with that same doctor. So this was then Thursday morning. I went in to see this doctor, and she said the blood work and urine came back normal, so there's no infection, but the x-ray shows that I have an impinged nerve, and it won't show because it's not as high tech as an MRI. It doesn't show exactly how severe it is. And we wouldn't be able to know unless I got an MRI. And she said, but you know, it's really hard to get in to get one of those, and this hasn't been going on for too long, so you should just wait 8 weeks and it should clear up on its own, and I'm just going to prescribe you with pain meds in the meantime. I think the old me actually would have just done what the doctor said and just said, okay, you know, but I just can't live like this anymore. I've been miserable. And so I told her, I don't want pain meds. I don't want pain meds to just mask what this is. I want to figure out what it is, and I want to treat it. I want to get it fixed. And I told her I'm terrified to walk down my stairs holding my baby because I feel like my leg's going to give out and I'm going to fall holding her. And so then she started, after I said that, she started asking me more questions about when it started happening. And I told her it started happening in the hospital after I gave birth. And then I told her, she asked, well, did anything happen with your epidural? And then I told her about my whole left leg thing. And she goes, oh, okay, well, let me see what I can do. And then she gets on her computer and says, all right, I'm going to book you an MRI for tomorrow in Walnut Creek. So it is now Friday, Valentine's Day, and I have an MRI at 9:30 p.m. in Walnut Creek to figure out what the heck's going on. So I can hear JJ. I'm coming, baby. Let me go grab him really fast. Okay, so I have an MRI booked for today at 9:30 p.m. You want to come over here and see? Come here. Come here, buddy.
No.
Okay. And I got the pain meds.
Hi.
Hi, sweetheart. The pain meds from... Come here. You want to sit with me? I got the pain meds from the doctor yesterday. Well, the prescription. I went down... The doctor. When I went downstairs yesterday to the pharmacy after seeing the doctor to get my prescriptions, she gave me 3 different prescriptions. Shh, buddy, can you go play? Can you go play for a little bit? Mommy's almost done, okay? Can you go sit down? Go sit in your chair. That's JJ's chair. Good job, honey. I went downstairs to the pharmacy to get the prescriptions, and I bought all 3 of them, and then they send you over to the pharmacist to go over the medications with you. Well, because the doctor didn't tell me exactly what it was. The first one was like ibuprofen. It was similar to ibuprofen. So I'm like, okay, that's fine. And it was supposed to help with pain, inflammation, whatever. The next one, please be quiet for me, okay? The next one was a muscle relaxer that can, number 1, make you drowsy, and 2, you can't drive when taking it. And they wanted me to take it 2 or 3 times a day. And then the third one was medication for people with epilepsy. And it was, I guess it's supposed to do something, you know, with the communication between the brain and your nerves and help in that way, but it can also cause drowsiness. They start with a low dosage. I think it was 100 milligrams or something, but they gave me this huge bottle of it. 1 second, okay? 1 second. Okay, 1 second, please. I'm almost done. JJ? Do you want to sit with me? Okay. Sorry, I'm almost done. So they gave me this big bottle of it, and Collie. And they told me she told me it was epilepsy, for epilepsy patients, and all gone. Throw it in the trash for me. This is why I can't film when they're awake, because it's just, now she wants to finish her bottle and he won't stop talking to me. So anyways, after the pharmacist went over those medications with me, I was like, I'm sorry, I can't take these. I don't want to take these. I have 2 babies at home. How am I supposed to function every day if I'm drowsy, or, you know, I can't drive or whatever? How am I supposed to take care of 2 kids? And the pharmacist goes, yeah, I completely agree with you. I probably wouldn't take these either. So like, okay, well, I want to return these 2. I'll take the ibuprofen, but I'm going to return these other 2 because I just don't want them. So I did that and got reimbursed for those, but I just thought that was interesting. I just think it's funny how... Throw it away for me, thank you. I just think it's funny how doctors will just, not all doctors, but will just throw medications at things, and I just don't want to be on a bunch of medications. And I know that if I didn't stand up for myself and tell the doctor, no, I need to get an MRI, this needs to be fixed right now, I'm afraid I'm gonna fall down the stairs with my baby. If I didn't do that, then I wouldn't be getting an MRI tonight. I just think if you go in to see a doctor, I mean, you have to stand up for yourself. I would just don't take no for an answer. Just keep pushing until you get what you want. The last thing I want to say is that with all of this happening, I just had a mental breakdown the other day. You know, it's been a little over 2 weeks with Colin's home, so we have 2 little ones here, and we're running on very little sleep because of Colin's. And during the day, you know, we're trying to juggle JJ, and thank goodness Joey's been in town. He still commutes to Napa every day, but you know, it's been hard, and it's hard for me because I'm waiting for, I ordered an Epidural Vista, the double stroller, and I'm waiting for that to come. And since I don't have it, I can't run errands with both of them. I can't leave the house with both of them because I need to contain JJ in the stroller, but she's in the stroller in her infant car seat. So it's been so hard. I think I've been feeling kind of just trapped at the house / I can't get out and just walk because it hurts to walk, and just trying to chase JJ down. It's just one thing after another. And then, you know, you're tired and there's always a ton of laundry to do, and there's always a diaper to change, and, you know, a bottle to feed and a bath to give. And it's just, I think I started thinking about all of those things at once, just on top of this injury that I don't even know how or when it will be fixed. I think just with this injury, I just started thinking about everything else. Like, I'm so tired and I have all this to do and this to do, and I can't leave the house. And I just started feeling sorry for myself, and I just completely broke down and just spent most of, I want to say, Wednesday crying. And poor Joey, he was just looking at me, and I just was in this depressed state. Like, okay, maybe this is what postpartum depression feels like, because I was just miserable. And I know it's all brought on by this stupid leg back thing. So I just hope we can get some answers with this MRI. And I don't know, I'm afraid they're just going to tell me it's just going to take time for the nerve to heal and you'll feel good in a few weeks, because it really does. It sucks. It's really hard to do anything. Well, thank you guys so much for watching. That is our update. I will keep you updated on my back / leg after I get this MRI. And I just want to wish everyone a happy Valentine's Day. I hope you have fun plans for tonight. Joey and I will be going to dinner and then to get my MRI, and my parents will be with our little ones. So, thank you guys so much for watching, and we will see you next time. Bye.